If you have type 2 diabetes or know someone with type 2, diabetes. Do you know why this type of diabetes appears? Many people with diabetes say, I hardly eat sugar. I don't understand why I have diabetes. Is sugar consumption really the only thing related to diabetes? Is that the main factor? Let's start by talking about what type 2 diabetes is. This type of diabetes is characterized by an increase in blood glucose that generally occurs after 40 years of age and is closely related to what we call an increase in insulin resistance. There are several factors that cause this increase in resistance. Among these, I want to highlight two: genetic predisposition, the accumulation of abdominal fat. Type 2 diabetes is a complex disease with a multifactorial origin, but here we are going to simplify it to make it a little easier to understand at least the main aspect of the disease's origin. It is worth remembering initially that insulin is the hormone responsible for favoring the entry of glucose into the cells. It is as if glucose needed a key that opens the door of the cells for its entry. This key is insulin. In type 2 diabetes, which develops over several years, we initially have a resistance to the action of insulin, which is the difficulty that insulin encounters to push glucose into the cells. Progressively, insulin becomes increasingly ineffective in overcoming this resistance. To exemplify, let's imagine a person who needs to enter their house. In this case, glucose would be the person, the body cell would be the house, and insulin would be the key that opens the door to the house. Of the people with a tendency to type 2 diabetes, this increase in insulin resistance would be an increase in the difficulty of the key to turn the lock of the house's door to open it. As a result of this resistance to the action of insulin, the pancreas, the organ responsible for insulin production, responds by producing increasingly larger amounts of insulin to try to overcome this resistance and achieve some control of blood glucose levels. Since this overproduction occurs for a very long period, the producing cells in the pancreas wear out and start dying, so that when someone is diagnosed with type 2 diabetes, they have already lost between 50% to 70% of their insulin-producing cells. This process of destruction of insulin-producing cells is continuous, and therefore diabetes is a disease that can progress over the years and require more medications for its control. Therefore, the emergence of type 2 diabetes comes from the combination of resistance to the action of insulin with an insufficiency in insulin production. And where does this insulin resistance come from, which is the initial problem of the whole disease process? Several factors may be involved, but as we said, the two primary ones are genetic and accumulation of abdominal fat. If you have a family member with diabetes, you have a genetic predisposition for insulin resistance. If one of your parents has the disease, your risk is 14%, but if your father and your mother have the disease, this risk jumps to 50%. And abdominal fat, sedentary people who have an unhealthy diet with a high caloric consumption, leading to the accumulation of abdominal fat, especially visceral fat, like the one located in the middle of the liver between the loops of the intestine, have a much greater chance of developing type 2 diabetes. This happens because this visceral fat secretes several inflammatory substances that contribute to this increase in resistance to the action of insulin. Therefore, even the person who does not eat sugar but gained weight eating other foods can have type 2 diabetes. The predominant factor is abdominal fat, visceral fat, and not sugar consumption. Obviously, those who consume more sugar have a greater tendency to gain weight and develop abdominal fat. Besides these factors, I think it is important for you to know some others associated with a higher risk of type 2 diabetes. Family history, being older risk increases over 45 years old, being overweight, high blood pressure, being of Asian origin, they have more visceral fat even with normal weight, or being a woman who gave birth to a child weighing more than 4.5 kilograms, had gestational diabetes or polycystic ovary syndrome. The message of this video to all people, especially those over 40 years old, is be attentive, take tests to evaluate if you have diabetes. There are even some holistic alternatives that can help a lot in this process, and many people do not know about them. Bitter melon, for example, has been used for centuries for exactly this reason. And when combined with ingredients like prickly pear, turmeric, chromium, and olive leaf in the right proportion, the effect on glycemic balance is much more potent than using any of them alone. I am not saying that it replaces medical follow-up, on the contrary, but as a natural support to your lifestyle, it is worth knowing about. If you are interested, I will leave the link in the video description.